Talofalava and warm Pacific greetings. I'm Lorenzo Kaisara, Community Liaison Manager for Total Healthcare and Local Doctors. And today, I'm speaking with Tāmaki Health Dr. Richard Hulme about the COVID-19 vaccine. Malo lelei, Dr. Richard.
Malo lelei, malo soifua, kia rana, bulavanaka, and warm Pacific greetings to you too, Lorenzo.
Thank you so much for joining me today. Richard, why is it important for New Zealanders to get the vaccine for COVID-19?
Well, we know how big a threat COVID-19 is overseas. We've seen a number of people mourning the losses of their loved ones, and we don't want that to happen here. So it's really important that we protect those who are at risk. So it's essentially anybody that's over the age of 16. But as you know, the New Zealand government has got the program rolling out in waves. So the first wave is going to be those who are at the border. And then the next wave is going to be those who are most at risk and over the age of 65. And then there's going to be frontline health workers and then the New Zealand general public.
How can people know it is safe?
Millions of people overseas have already received the vaccine. So we've got quite a lot of information about that already. There's a lot of clinical trials that are going on both in New Zealand and overseas around collecting information on what are people experiencing. And when you do go for your vaccine, you'll receive a lot of information at the time. So here's an example. It's after your immunisation, what can you expect? And you can see here that this is what you may feel. So commonly people will have a little bit of soreness at the site of the injection. That's very common, all right? You may experience some headache. You may experience some tiredness. And obviously the headache does get better with paracetamol and ibuprofen, which is known as Brufen or Nurofen. So those things are sort of simple side effects which do improve. And most people are usually feeling much better either the next day or within 48 hours.
Will there be any other side effect that people need to be aware of?
No, obviously I've just had the vaccine myself, and people are obviously scared. It's a new vaccine. Is it really dangerous? So I researched that myself before I had it myself, and the good news is that it's a very, very safe vaccine.
And will it cost me anything to get the vaccine?
No, the vaccine's for free.
Richard, who is eligible to get the vaccine?
So anyone over the age of 16 is eligible to get the vaccine. So you don't have to be a New Zealand resident or permanent resident of New Zealand. If you're in New Zealand, there's enough vaccine for you. So don't hold back. When you get the opportunity, get yourself, get your loved ones, and anybody that's that is eligible, to encourage them to go along and get a vaccine.
Even for those who are here on visitors visas and work visas?
Visitors, people who are overstaying, anybody. Right? Anybody over the age of 16, you're free. It's free to get the vaccine, so I'd encourage you to get protected.
Thank you very much. Me taki maata, malo pito vinaka, and whawhetai tele lava, Dr. Richard. Hopefully that helped to answer some questions you might have. For more information, call Healthline on 0800 358 5453 or speak to your family doctor or visit www.covid19.govt.nz. Whawhetai lava.